Hey guys, Dr. Heimlich here. And believe it or not, the majority of the time, whenever patients come in with, of our new patients who come in with complaints of low thyroid symptoms, they've been prescribed antidepressants. And a lot of times, majority, they've been prescribed antidepressants before they even get prescribed any type of thyroid medication. Now, why would this be? You come in, you're saying, I'm lethargic, I'm tired, I'm fatigued, I'm gaining weight, I'm depressed, my hair's falling out, my nails are brittle. Here you go, let's take some antidepressants. Well, the reason usually is because they haven't been tested, or the doctor doesn't test them to see what the thyroid is. And even if they do, the thyroid ranges are pretty forgiving. And we've talked about that in other stuff. But today we're going to be talking about what happened to one of my other patients. He came in and he was told to see a psychiatrist or psychologist because he was just looking for attention. And you may have been told that type of stuff as well. It's very common in our office to hear that type of scenario, but this one is a little special. And I've talked about this patient on a previous blog. He had really low cholesterol, and he was told that by his doctor, cardiologist, it's okay, babies have low cholesterol, and if it's good enough for them, it's good enough for you. And I also described a little bit about why you want to have a cholesterol up to a certain level, because our body produces cholesterol every day. It uses it as building blocks for the rest of the hormones, and we need a certain amount of it in order for our body to function properly. Now, a point to remember is cholesterol is like anything else. It's just a small piece of your healthcare puzzle. And you have to take a look at everything all together, put it together, in order to see why your body isn't functioning correctly. Now, this guy, he was an active 64-year-old. And he goes into one of the famous clinics here in town, complaining that he's got some cardiovascular stuff. He's got what he thinks has a heart attack. Three times he's told it's just rib pain and anxiety, don't worry about it. Until the fourth time he goes in the ambulance and he actually has a heart attack. He's goes to see his internist after the surgery. He's second time with this internist. And the intern, and he's there with his wife. And his internist asks if they're familiar with the syndrome that where a patient comes in and they harm themselves and do certain things to themselves so that way they get attention. So attention is brought to them. And the patient's wife was sitting there and said, "Doctor, are you suggesting that my husband had this third heart attack because he's looking for attention?" And the cardiologist or internist is like, "Oh, no, not at all. But here's a card of a good psychiatrist I think you should probably go see." She was pretty upset, as well as she should have been upset. And my patient was sitting there, and he said, "Hey, doc, if I wasn't so darn beat up and fatigued from the surgery and the heart attack, I would have got up and belted that guy." And you know what? I'm not one for physical altercations, but, you know, maybe that would have been something that would have been indicated, because that's totally inappropriate. I mean, does that make any sense to you? This guy's had his third heart attack, so maybe you should go see a psychiatrist and get some antidepressants. I mean, sure, his recovery was slow because he just had a heart attack. And, you know, it's just crazy. The point is thyroid plays a huge role in cardiovascular health too. Okay, I mean, every single cell in the body, we've talked about this before, has a thyroid receptor site. And whenever you have thyroid problems, low thyroid problems, Hashimoto, things like that, it can cause a dysregulation to go on with a whole bunch of different things: blood sugar dysregulation, adrenal dysregulation, and a whole other myriad of things that go down, and that can actually cause us to get higher than normal cholesterol levels, could cause more plaquing. But the thing to do, though, is not just go out and take some cholesterol lowering medications or some other things. It's better to try to tone down, control that autoimmune attack on yourself, so that way you don't have these other manifestations. I mean, it probably sounds familiar to you, and you've probably heard from your doctor, or maybe not, that if you have thyroid and you're taking thyroid medication, you know, thyroid disease, you increase your chances of cardiovascular diseases, or having high cholesterol, or needing to take cholesterol lowering medication. The point is you need to find a doctor who knows what we've talked about and who knows how to take a look at you and see all the different pieces of the puzzle. Find out why are you still having the problems that you're having and the symptoms that you're having, even if your labs may come up normal. Because if your thyroid medication was the only answer to what's going on, as opposed to a piece of the puzzle, then you wouldn't be watching this video. You'd be out enjoying your life right now. So the take-home message here is, find a doctor who understands what we're talking about. I'm Dr. Heimlich. Thanks for listening.